Are you looking to get ready, be prepared, and transform your financial future? Then you've come to the right place. This is the Get Ready Money podcast with Tony Stewart, where Tony has insightful conversations with financial experts who are changing the way we think about money. Catch up on the latest financial trends and hear practical advice from Tony and his expert guests so you can build healthy habits that work. Be empowered with tips for implementing small changes that can have a big impact on your financial future. So sit back and get ready to hear from today's guest.
Welcome to the Get Ready Money podcast, changing the way we think about money. I'm your host, Tony Stewart. Today, I'm joined by Drew Shockley, co-founder of Move Health. We'll explore why healthcare insurance planning is more confusing than it should be and how we can change that. Drew, welcome to the podcast. Thanks for joining us today.
Tony, I'm honored to be here. Thank you so much for having me and allowing me to represent our team over at Move Health.
Yeah, well, fantastic. I'm really excited about what you're doing because health insurance is pretty complex. So, let's jump in. Tell us a little bit about yourself. What is your origin story and how did it lead you to co-found Move Health?
Sure. That's a great question, Tony. I oftentimes, tell this story that I don't think that there are very many kids running around America saying that they want to be a health insurance and a Medicare agent when they grow up. And that certainly wasn't the case for me. I grew up in East Tennessee. My granddad was a dairy farmer. I grew up working with him on the farm, and he told me, son, you're going to go to college. And I said, okay, I'll go to college. And so I did. I was a music major and transitioned to golf, and then eventually got a business degree. And I had the chance to really start working. My first career job, or my first real job, was working for an agent at Anthem Blue Cross Blue Shield. So my story is kind of cool because my wife and I were getting ready to get married. We needed to buy health insurance, and we went into the office to enroll in a health insurance plan. And it led me to being offered a job as a sales assistant for this agent at Anthem Blue Cross Blue Shield. So that's how I got started. That was almost 20 years ago, Tony. Which after spending a few years at Anthem Blue Cross Blue Shield, I, along with a business partner, started a company in the space in 2008. We were building that. That was a direct-to-consumer agency which worked with clients across the country to help them enroll in health insurance and Medicare. This is all like pre-Affordable Care Act, pre-Obamacare, all of that stuff. And we did that for 12 years, built that company up, and then we actually successfully sold that company in the year 2020. And we worked out our contract with them for 3 years, and then that led us to found Move Health in 2023 and start working with financial advisors across the country.
Well, fantastic. Well, just give us a quick overview. Is how does Move Health work? How does it simplify the process for individuals and advisors?
Sure. At its core, Move Health is Move Health is a platform that is utilized by financial advisors across the country, forward-thinking, progressive financial advisors that are bringing health insurance and Medicare planning into the forefront of their practice. We believe that there is a problem for clients that are in that early retirement window. We often identify that as clients between the ages of 55 and 64 who have been diligent, they've saved money, they've worked hard, and they would love to quit their job, but the last piece of the puzzle holding them up is health insurance. Oftentimes, these clients are sitting down with financial advisors. They're saying, hey, can I quit my job? And that financial advisor is saying, yes, money looks good, accounts look good, your house is paid off, the kids are grown, etc. All we need to do is figure out health insurance. And then that's the point of inflection where there's a lot of confusion, there's a lot of issues. Financial advisors have limited information. In some cases, the information they have is wrong. Clients are scared and they're worried and they're concerned because they've had healthcare coverage through their job for 30 years and they don't know what to do. That's where Move Health comes in. So at its core, We've built a platform that provides tools for financial advisors to accurately predict the cost of health insurance and Medicare in a pre-retirement or retirement phase. And we've recently implemented the health planner technology, which was developed by a company called Caribou over the last few years. We acquired Caribou in January of this year and implemented the health planner technology into the Move Health platform to make us the only and the first and the only end-to-end solution for clients that are needing health insurance and Medicare analysis, providing that through their financial advisor all the way through to enrollment with the health insurance companies that are available on the platform.
Well, that's awesome. And for people who are watching and listening, I had a podcast episode about a year and a half ago with Christine Simone, the founder of Caribou Health, that I will reference in the show notes. So people who are interested in learning more about the Caribou and the Caribou process, you'll be able to go out and do that. So, that's fascinating. And, it hits home. So let's say I have a friend who is in that age bracket, who is going through that with his wife, and part of the holdup for my friend is the cost of the individual health insurance is, what are you recommending in that situation? Because it's like $13,000 a year on the, California healthcare exchange.
Sure. So Tony, that's a great question. And, your friend is kind of faced with the same, same decision point of a lot of people. They're saying, hey, I've had healthcare coverage through my job for years and years and years. I've never really had to think about it. Every year open enrollment comes around. It's kind of, do you want plan number 1 or plan number 2? You just check a box and it's all taken care of, right? People don't have to think about it. Well, first thing, when you transition off of an employer plan, if you're going to quit your job or retire early or move to part-time and you're losing benefits, the first thing to know is that now in the post-Affordable Care Act world, the plans that are available on the individual market, as long as they meet the Affordable Care Act requirements, are going to cover pre-existing conditions. So you don't have to worry anymore about a previous cancer or a heart attack or a stroke, or, whether your height and weight is a little bit out of bounds or you're taking a medicine that's expensive. Like, all of those things are not a factor in the cost of your individual health insurance. That's post-Affordable Care Act. It's been that way for over 11 years now. Coverage is guaranteed issue on the individual market if it meets the Affordable Care Act guidelines. Secondly, these marketplaces have been created across the country, and over 30 states utilize what they call the federal marketplace, which is healthcare.gov. That's where the Affordable Care Act compliant plans are offered. And then many states have a state-based marketplace, like California, you mentioned before, a state like Washington, Colorado, New York. They have these state-based marketplaces where the Affordable Care Act compliant plans that are available are on the state-based marketplace. So our team, Move Health, we have, our platform, which financial advisors utilize. And then we have a team of licensed agents that are licensed, certified, and contracted with the insurance companies that are made available in each of those states. And we walk people through that entire analysis and the enrollment process from beginning to end. Your question was, hey, what do we do about cost? Well, in many, many cases, we are teaching financial advisors and the clients of financial advisors how to leverage the advanced premium tax credit that's made available through the Affordable Care Act for clients that do not have employer-sponsored coverage. They're not eligible for Medicare, and they're not eligible for Medicaid. Those are the three things. Medicaid is state low income. Medicare is, for those 65 and older. So if you're leaving an employer plan, it's very possible that you would be eligible for this advanced premium tax credit. This is a pretty meaningful dollar amount. We're not talking about, a couple $100 here or there. We're talking about potentially in the thousands and thousands of dollars that clients are able to utilize in this advanced premium tax credit metric, which can and does make a significant difference in the cost of healthcare coverage for millions and millions of clients across the country.
Well, that's really helpful. And, I think that's something that sometimes we're not aware of, and this is a benefit for people. This is not an ad for people to go out and work with a financial planner, but it is, a reminder that there is always more to the challenge. So doing your own research on this, and if you are thinking about early retirement, that is a time to work with a financial planner. And that doesn't mean that you have to have a permanent relationship with a financial planner, but you can hire them for an engagement so that they can go through this kind of planning process with you. And for financial planners, as you hear me talking all the time about, like, hey, insurance planning needs to be part of the financial planning process. It's a huge component of somebody's financial life. And you think of it this way, it's their emergency fund for the big emergencies. So I'm glad you're providing those resources and tools. So let's talk about the complexity of healthcare insurance, because I've talked with so many friends and just acquaintances who are like, okay, I'm at open enrollment, I have these choices, I have like 5 different insurance companies to choose from, I have deductibles to choose from, I have in-network, out-of-network, all these things. Is how did healthcare planning get so complex?
That's a great question, Tony. I wish I could answer that in a real simple, succinct way. But I'll tell you, having followed, the health insurance industry, over the past 20 years, we're in a position right now, post Affordable Care Act, really, irregardless of which side you were on from a political standpoint, I will say it was one of the most massive pieces of legislation that we've ever seen. It was a massive overhaul of health insurance. It was massive overhaul of health insurance for employers, for retirees, for individuals, the state Medicaid programs. It changed and influenced healthcare and how healthcare was delivered through facilities and through individual providers and standalone clinics. Like, it was massive. And so there are a lot of problems with it, but there were a few things that were really beneficial. And I'll tell you, the advanced premium tax credit that I mentioned earlier, Tony, this is something that we find every single day that clients of financial advisors don't fully understand. The way that it works today, and has for the past 11 years now at the time of this recording, the advanced premium tax credit came out in 2014. And it was made available for clients that do not have coverage available through a job, and they're not eligible for Medicare or Medicaid. So that's people that buy their own coverage. It could be someone that's an early retiree. It could be someone who's a 1099 independent contractor, a dependent, a student over age 26. I mean, somebody that's self-employed, somebody that just, works at a small company that doesn't provide benefits. But this is a tax credit that comes in the form of a premium payment to insurance companies. And so it's a collaboration between the federal government, insurance companies, and the client or the member that is enrolling in the plan. Today, the way that it works is that plans are categorized into metal levels, Tony. So we have simplified the way that plans are categorized. So there are gold plans, there are silver plans, there are bronze plans. Each of those have a specific actuarial value of how the plan is supposed to work. But on its surface, gold, silver, and bronze can have simplified the way plans are designed. And all plans are subject to the same requirements. So no more can you have a lifetime maximum. Plans must have unlimited lifetime maximum. Plans must all cover preventive care services like physicals, checkups, pap smear, mammograms, annual blood work, lab work. They all have to cover that. The only thing that varies between health insurance companies today are, copays and deductibles and out-of-pockets. And even then, the federal government limits the out-of-pocket maximums that an Affordable Care Act compliant plan can have. So we've seen a lot of standardization in the space when it comes to plan design. And the way that the advanced premium tax credit is impactful on those healthcare plans is that the client has a maximum limit today, as of 2025. The client has a maximum limit of 8.5% of their modified adjusted gross income for a silver level benchmark plan. So the balance of this, or what you should take of this if you're listening to this for the first time, is that if you don't have coverage available through a job for Medicare or Medicaid, you should be working with, a financial advisor or a tax planner or somebody like that to help you manage your modified adjusted gross income. Because the more you can control your modified adjusted gross income, or the more you can manage your modified adjusted gross income, or the more you can drive down your modified adjusted gross income, the more advanced premium tax credit that you're eligible for, will increase. You will find many cases, Tony. You mentioned a case where, say a husband and wife in California is staring at 13,000. A case study that I use very often is a husband and wife, early 60s in Nashville, Tennessee. They're seeing premiums, Tony, of $25,000 a year. Double of what you're recommending there or suggesting. But with the management of modified adjusted gross income, they're able to drive the cost of that healthcare coverage down to 8.5% of their modified adjusted gross income. So simple math, if you drive their modified adjusted gross income down to 100,000, their premiums will be no more than $8,500 for the year. That means that their advanced premium tax credit that they would be eligible for from the federal government pushes $17,000 to $18,000 a year. If you have a client that's retiring at 61 or 2 or whatever, and they're getting upwards of $17,000 to $18,000 a year for 1, 2, 3, 4 years, just knowing about the advanced premium tax credit can make a $50,000 to $100,000 difference in a retirement plan for a client that is leveraging it appropriately. So it's still relatively complex, and yes, of course, it's hard to follow. But once you start getting into it, we've seen some standardization of benefits. The advanced premium tax credit that's been implemented has been really meaningful and impactful. And, we're seeing that make a massive difference in the cost of healthcare coverage in clients for early retirement.
Well, fantastic. That is super helpful, really informative. That was something I didn't know much about. So I hope for people watching and listening that this has been impactful for you. I think one of the things with health insurance is that, and insurance overall, is that people forget that insurance is a payment mechanism, that it's not the cost of healthcare. And people oftentimes say, oh boy, the healthcare insurance industry is just, they're the problem in the health insurance world, in the healthcare world. Is how do you break that down for people to separate the insurance component from the healthcare component?
Yeah, it's a great question. I think that part of the Affordable Care Act was designed to help remove some of those barriers there, where providers can be focused on care and the outcomes of care, versus speed and quickness, to move someone along. So I think that's really difficult. I think in general, most providers, most doctors, here in America, they're doing the right thing. They care about their patients. They take an oath, to protect and serve and do these things. I think in general that's happening, but it doesn't mean that we can just be blind to the process. So I suggest and recommend for clients out there to be smart consumers. There are a bunch of tools out there that you can utilize to make sure that you are going to the right, to the most effective providers. You can look at ratings, star ratings, things like that for providers in particular areas. You can look at even cost comparisons, for various services. And so, I think that it's important. And I think, if you look at, the U.S. today, over 90% of the United States has healthcare coverage or access to some form of healthcare coverage. And is utilizing it. So most of us have something. It's just a matter of us being smart consumers and knowing how to best leverage it.
Fantastic. So since your platform is only available to people working through advisors, are there any resources that people who aren't working with financial planners can go to that you could recommend?
Yeah, of course. Clients can go directly to our site, movehealth.io, and you can utilize resources there. We have, various blog posts and writings and research that we've done, case studies, and, videos and various things that we've been featured on with other media partnerships. And so that's accessible to clients directly. And we do prefer that a client is working in conjunction with a financial advisor, because so much of healthcare planning today has to do with the management of modified adjusted gross income. We aren't tax planners. We're not financial advisors. We don't do any competing services to a financial advisor or any other type of insurance. We don't do life insurance. We don't do home. We don't do auto. We don't do disability. We don't do those things. We're sole focused on health insurance and Medicare planning. And so we need to be working in collaboration with other professionals to make sure that, make sure that you're in the best spot possible. But you can go directly to our site at movehealth.io and utilize those resources as well.
Fantastic. And for people watching and listening, there will be a link to the Move Health website so you can check it out. And it's great to know about those resources. So what role can financial advisors play in helping clients navigate healthcare insurance decisions? Because I know from my experience as an insurance consultant working directly with financial planners is sometimes, they're not comfortable becoming involved with the process. So how can they be comfortable and jump in?
Yeah, that's a great question. I think the answer lies in the fact that, our partnerships with financial advisors, we don't expect you to be an expert. In fact, we don't want you to. We know that you can't be a jack of all trades. If you are, that means you're a master of none, right? It's like, so health insurance and Medicare is something that's very specific. So what we recommend for financial advisors to do is really to identify the need during a transition process. So this could be an example of somebody that's retiring, and they're quitting their job. That's going to have, a change or an impact on their health insurance coverage. No longer can you just say, wait until you're, 63 and a half and go on COBRA for 18 months. I would argue, and I would say very clearly, I think that's an awful decision for somebody just to blindly say, I'm going to wait until I'm 63 and a half and go on COBRA for 18 months. Most of the time, COBRA is significantly more costly and can provide less benefit than what a client could enroll in on the individual marketplace with an Affordable Care Act compliant plan and utilizing advanced premium tax credits. No longer can a client, just say, I'm going to wait until I'm 67 because my spouse is 2 years younger and get them to Medicare. That shouldn't be the case. Like, that shouldn't be their plan, or their process to wait. I think so for a financial advisor, if you have clients that are in that transition period, they're thinking about retiring, or they want to retire, or they think they're trying to get to a certain milestone and it's all around health insurance, don't let health insurance be the barrier, or don't let it be the guiding principle to how and when they decide to retire. Buying individual coverage today is very easy. It's very simple. And I just would recommend, if you're not utilizing a partner today, you can partner with Move Health, or you should find an expert that you know and trust that is certified in Affordable Care Act compliant plans and knows what they are doing when it comes to serving clients in this way. So as a financial advisor, identify people in transition. Look for dependents that are turning age 26. So you have clients, that have kids that are reaching that age. They're going to be coming off their employer plan, right? Watch for the traditional moves, at 65, the Medicare transition. And in our world, for financial advisors that are working with Move Health, all you have to do is just identify, that client during that period. And we work with them hand to hand from beginning to end. We're the only company in the space that has the tools and the ability to work with that client hand in hand alongside of a financial advisor in a joint relationship. So I don't recommend for clients to become or for financial advisors to become an expert or to even go get licensed or certified to even do it. It's complex. It's its own practice. So, I recommend, developing a partnership with us or, a company like us, or a local agent to help you in your clients through this process.
Fantastic. So that's really informative. And, so one quick question before we get into the get ready, quick questions is, does Move Health have a network of agents or recommendations for agents that people can find?
Yeah, so we do. No, so we have our entire own team. So every time that a financial advisor would be working with Move Health, they would be working directly with a Move Health employee. So we have a team of licensed agents. We're not referring clients out to some unknown source or to somewhere else. We are able to serve clients in all 50 states, in federal and state-based marketplaces for individual plans, and all Medicare eligible, situations as well. So we are not referring clients out. We're not sending them to some unknown source. You're working with us directly on our platform, directly with a Move Health agent, and taking that client directly from beginning to end all the way through the enrollment process.
Fantastic. So I hope for the advisors and other financial consultants who are listening is that you check out Move Health. This is obviously not an advertisement for Move Health, but that at least conceptually to take a look and see how something like this could benefit your practice. And as a consumer, check out the tools and think about some of these things. So, Drew, let's jump into what I call the Get Ready Hot Take Trio. 3 quick questions to help people change the way they think about money. These are rapid fire questions. The first one is, what myth are you trying to break about healthcare insurance planning?
The myth that we're trying to break here is that you don't have to keep working to have benefits through your job. You can quit your job and find quality healthcare coverage that's affordable and gets you through to that next phase of life. We want to break the myth of clients, or people, continuing to work in a job that they don't have to work in, a job that they don't really like, and a job that that they don't really need, all because of healthcare coverage. So we want to break that myth. We want to help people move into the next phase of life, and that's what I wake up every day excited to do.
Well, that's awesome. And I know, like I mentioned, for my friend, but, I've run across that with other clients and friends, people who feel like that's the reason, to stay with the job. So that's a great mission to have. And I hope that you can expand and eventually offer a direct to consumer product as well. So it's exciting. So, let's get out the time machine for this next question. What advice would you give your younger self knowing what you know now about money?
So, that's a great question. So I recommend, all those that are younger than me, start saving quicker and faster and more effective. I think that's a common thing that we all think. I was fortunate enough to have some really strong voices in my life, and my wife and I did a very good job at saving, and we did that at an early age. But I know a lot of people wait until they're in their 30s or even later to start saving, and that's the biggest regret I think a lot of people have at younger ages. So save. Spend less than you make. Those are the things that I would say, for that's applicable to everyone.
Fantastic. That's a great tip, and people watching and listening to the show for a while have probably heard this one once or twice. So it's a great tip, but saying it again reinforces the importance of doing this and the time value of money. So, Drew, to wrap up, what is your number one tip for changing the way we think about money and health insurance?
My number one tip is explore your options. Make sure that you educate yourself about how things work. Every single day, Tony, we are busting myths about the individual marketplace, that it doesn't cover pre-existing conditions and it doesn't do this and it doesn't do that. We're breaking those myths all the time, and we're unlocking retirement for people through healthcare planning. And you can quit your job. You can find affordable, high quality healthcare coverage that covers pre-existing conditions, and it can be affordable through effective income management. And, those are the things that, that again, we wake up and we're excited to continue working. Between the ages of 55 and 64, Tony, there are 40 million Americans that would love to quit their job and would love to move into the next phase to take care of their grandkids, or buy an RV and drive around the country, or travel, or do whatever, go hiking or play golf or go fishing or do whatever. But they're stuck in their job and they don't know how to break free from that. And so explore your options, learn about individual healthcare coverage, talk to experts and talk to professionals, and come up with a transition plan that you're confident in.
Fantastic. That's a great tip. So Drew, where can people learn more about you? Where do you hang out online, and where can they find Move Health?
So Move Health, is movehealth.io. That's movehealth.io. You can find me, Drew Shockley, on LinkedIn. It's where I'm putting the most relevant content for financial advisors and for clients. If you're out there and you're interested in learning more about this transition, or health insurance, or Medicare planning, or if you're a financial advisor that wants to add that to your practice, visit us at movehealth.io. and go through our process there. And if you're a client that's needing some help and needing some assistance, you can go to movehealth.io and click the I'm a Client page, and you can go directly through our resources and schedule a time to work with one of our consultants there too. So, Tony, really appreciate the ability to be here, and I love what you're doing with your podcast and the content that you put out, and it's just great to be a part of it.
Well, fantastic, and appreciate you being here today, Drew. Appreciate your time, and for everybody watching and listening, as always, there will be links to Drew's LinkedIn profile and to the Move Health website, so you don't have to keep replaying the video to get that. So thank you, everyone, as well, for tuning in to this episode of the Get Ready Money podcast. If today's episode helped you think differently about money and healthcare insurance, please be sure to subscribe and to share with a friend. You can also join the Get Ready movement on my website at tonystewart.com to receive the Get Ready newsletter with my recommendations and 10 things that are moving the needle on financial literacy this week. Until next time, let's keep changing the way we think about money.